Hi Angela, it's lovely to have you here today. As you know, I'm a spine surgeon, deal with a lot of patients, men, women who come with back pain, but I think people don't really understand the physiology behind everything. So tell us more about what you do and
Well, I see men and women with sexual problems, basically. So with women, you might see women who are struggling with arousal or with orgasm, and that's quite a common sexual problem.
So how do women experience orgasm? Tell us more about that.
Well, what happens, really, to have an orgasm, you need to get aroused. So arousal occurs because because emotions, intimacy, touch, sexual thoughts, sexual feelings, and so because of that arousal, then various changes start to happen in the body, and so you get clitoral engorgement. The vagina actually lengthens and widens during arousal to make sure penetration is comfortable. So there's a whole process that goes on, and also you get like lubrication and swelling of the vulva.
So I think the basis is the clitoris. Tell us more about it. What is the importance of it, and why so much hoo-ha about it?
Well, the thing is with the clitoris is that's how most women orgasm. So, only about 30% of women will have vaginal orgasms, but 100% of women have the potential to have clitoral orgasms. And if you look closely at the clitoris, it's actually, what you see on the outside, there's so much more to it underneath. And if you look at the clitoris closely, you've got a foreskin, you've got a glans, you've got a tiny shaft. It's actually the equivalent to the penis on the female body.
And I'm pretty sure nobody knows that.
I know. And the thing is about it, it's got no reproductive purpose whatsoever. It's purely there for sexual pleasure. And we might make a big fuss about it, sort of from a cultural point of view, but evolutionary, there's absolutely no purpose to it other than pleasure. It's a bit like a byproduct, just like men have nipples.
It's very interesting that you say that. But, well, women are complicated. I don't think I need to even say that. There's either an on or an off. But how can women turn off this off mode?
Well, that's when we start looking at sexual response. And if you think about sexual response with men and women, if you think about it in terms of accelerators and brakes, men have more sensitive accelerators and women have more sensitive brakes. So if I'm seeing a woman with a sexual problem, I might be looking at what is actually getting in the way of her feeling sexually aroused or being orgasmic. So that's about looking at the offs. So if you can identify the offs, then you can focus on the accelerators.
Yeah, which makes complete sense, actually. But women don't really have anything to aid them in terms of pills like men have.
No. And that's unfortunate, because when you've got something like back pain or medications that can impact on your arousal and perhaps your ability to orgasm, I do think you definitely need to talk to women about that, because at least if they're aware of that, that can stop them worrying. Now, in terms of help without a tablet, you've really got a few things. One, you need to be talking about sexual positions, because the more comfortable you are, the less pain's going to interfere with your arousal and potential to orgasm. A good lubricant, so you want an oil or silicone-based lubricant. Talk about positions. Also, you might need to focus more on relaxation and different types of touch that can increase your arousal. That could be really helpful. And the other thing I often suggest is using a vibrator.
Considering you're having them here, tell us something more. How would you think in a setup of medicine, how could they use it in terms of from the patient point of view?
Yeah, well, there's a number of reasons where we use them. If you're trying to help with arousal, then you might use either one of these to stimulate the clitoris. You might use it to, because that will help with blood flow. It will also help with nerve sensation. And also when the vibration's going on, it's very difficult to think negatively, so it can distract you from negative thinking. So one like this, for example, you would put, wrong way around, you would put it in the vulva, and that's going to do help stimulate blood flow, and that can be really useful if a woman has a condition that actually means that she's less sensitive. So some women that have undergone breast cancer, if they're on a medication that actually changes their hormone levels, something like tamoxifen, they can start to experience less in terms of arousal. So that can be really helpful. Also, if a woman's got back pain, so she's struggling to get aroused, you might use something like this to help her get more arousal. The other way we use them is some of the smaller ones. Sorry, this is my vagina, by the way. Well, it's not my vagina, but this is my hand. So when women have pain, sometimes, even if they've got back pain, then the pelvic floor muscles can get quite tight. Now, if that's the case, one of the ways we use a vibrator, when either one of these would do, is you put it inside the vagina and actually you put pressure on the muscles in the pelvic floor, and that can help those muscles relax. So if a woman has got a problem with sexual pain or discomfort, and there's no other medical reason for it, she's been examined, but they think there's a problem with the pelvic floor, then certainly using a vibrator like that against the muscle can be really helpful.
Well, these are very interesting thoughts, and I think this is something that people need to know about, patients need to understand.
And the other thing I would just say, just to point out, they need to use a lubricant as well. Because if you are using one of these vibrator, it's so much more comfortable if you've got a good lubricant.
Well, that is very true. Angela, thank you so much for shedding light on all of these topics.
My pleasure.
It was great talking to you.
Thank you.
Thank you.